10 High blood sugar warning signs you shouldn't ignore. High blood sugar, what is it? The condition of hyperglycemia, often known as high blood sugar, is brought on by an accumulation of extra glucose in the blood. Those with diabetes are more likely to be concerned about this than those without the disease. According to Dina Adamoulim, MD, Assistant Professor of Endocrinology at the Icahn School of Medicine at Mount Sinai, our bodies are normally quite good at maintaining the ideal balance of our blood sugar. But high blood sugar can occur in specific circumstances, such as when a person has diabetes. A fasting blood sugar of more than 125 mg/dl is regarded as hyperglycemic, according to the Cleveland Clinic, and blood sugar, also known as blood glucose, is measured in milligrams per deciliter, mg/dl. The Cleveland Clinic states that if a person's blood glucose level is greater than 180 mg/dl 1 to 2 hours after eating, they may also be diagnosed with hyperglycemia. Optimal blood sugar. The pancreas normally secretes just the proper quantity of insulin, the hormone your body needs to assist the transfer of glucose from the bloodstream into the body cells for energy usage or storage, the NIDCADs. This happens when the glucose that comes from the food we eat enters the bloodstream. This maintains a rather narrow range of blood glucose levels. According to Dr. Adamoulim, a person who can maintain their blood sugar levels without any issues should never experience substantial hyperglycemia. According to the American Diabetes Association, a fasting blood sugar level of less than 100 mg/dl is considered normal in people without diabetes, ADA. Low blood sugar. According to the National Institutes of Health, low blood sugar, also referred to as hypoglycemia, occurs when your blood sugar level dips below normal, NIH. According to the Mayo Clinic, low blood sugar is typically indicated by a fasting blood sugar of 70 mg/dl or less. Causes of high blood sugar. You would believe that eating really sweet food is all it takes to cause hyperglycemia, but it's not quite that straightforward. Yes, eating a lot of sugar or carbohydrates can cause your blood sugar to rise, but at that point, your pancreas usually gets to work producing insulin to transport the glucose to your body's cells. But when a person has diabetes, this well-calibrated mechanism goes awry. According to the CDC, type 2 diabetes accounts for 90% to 95% of diabetes in adults. According to the NIDC, type 2 diabetes is caused by either insufficient or poor insulin utilization by the body. According to the NIDC, a person with prediabetes will have blood sugar levels that are higher than average but not quite in the range of type 2 diabetes. Additionally, with type 1 diabetes, the body produces very little or no insulin. In any case, the end consequence is additional sugar hanging out in your system, which will make you feel terrible right away and endanger your health in the long run. High blood sugar warning signs. Anyone who has been given a diabetes diagnosis will be familiar with how hyperglycemia feels. If you have diabetes, you can also monitor it by testing your blood sugar frequently. However, being aware of the symptoms of high blood sugar could encourage the millions of individuals who have diabetes or pre-diabetes but are unaware of it to seek medical attention and receive a diagnosis as soon as possible. The NIDC explains that while type 1 diabetes symptoms might appear quickly and severely, type 2 diabetes symptoms can develop gradually and be so mild as to be undetectable. According to the NIDC, the majority of persons with prediabetes really have no symptoms. Therefore, the NIDC advises getting checked if you have risk factors such as a family history, being overweight, or being over 45. Even so, it doesn't harm to be aware of the numerous short and long-term indicators of high blood sugar, especially if your risk is increased. Early on, hyperglycemia can cause a range of symptoms, including 1. Tiredness. According to Dr. Hatipoglu, feeling exhausted may be the most typical early indication of high blood sugar. She adds that it's also one that can happen, to a minor extent, with even the typical, mild blood sugar swings that occur in persons without diabetes, or with pre-diabetes, when they ingest a lot of simple carbs like sugar. In fact, fatigue is a somewhat vague symptom, and can even be a sign of low blood sugar, as Dr. Adamoulim points out. But if you frequently experience exhaustion soon after meals, particularly those high in carbohydrates, it can be related to your blood sugar levels. People frequently express their want to snooze following lunch or their inability to open their eyes after dinner after consuming large quantities of pasta, potatoes, or sweets, according to Dr. Hatipoglu. It should be made clear that eating these meals is completely okay. But if you discover that they consistently cause you to feel a particular manner that worries you, like being abnormally tired, it may be an indication that you should speak with the doctor. 2. Often urinating. Your kidneys start trying to pour out more sugar to get rid of it when your blood sugar level is too high. And they draw out water along with the sugar as they excrete it, says Dr. Hatipoglu. You end up using the restroom more frequently as a result. 3. A rise in thirst. Dr. Adamullam explained that this is a natural consequence of peeing more since your body becomes dehydrated. The doctor claims that people start to feel thirsty all the time. According to the Mayo Clinic, dehydration also starts to cycle. The more you urinate, the more thirsty you become, the more you drink, the more you urinate, and so on. 4. Migraines. According to Dr. Hatipoglu, headaches can be brought on by dehydration of any kind. Of course, headaches can indicate a wide range of conditions, but if they are new or present in conjunction with other symptoms, it may be worthwhile to seek medical attention. The dehydration, aside from making your headaches worse, can also make you feel more tired. 5. Blurred vision. The Cleveland Clinic states that when there is too much sugar in the blood, it can have an unanticipated impact on the eyes and other parts of the body. According to Dr. Hatipoglu, the fuzzy appearance is actually caused by additional sugar that becomes stuck in the middle of the eye's lens together with a small amount of water. This is transient, it's not the same as the long-term eye damage that can result from a condition like diabetes. 6. Disorientation, nausea, and vomiting. The U.S. National Library of Medicine states that despite their varied nature, these symptoms are all indicators of the rare and potentially fatal condition known as diabetic ketoacidosis, DKA. Along with the aforementioned signs and symptoms, DKA can also result in stomach pain, difficulty breathing, dry or flushed skin, fruity-smelling breath, and attention deficit disorder. According to the U.S. National Library of Medicine, it typically affects persons with type 1 diabetes and is occasionally the first indication that they are ill. In type 2 diabetes, DKA can occasionally manifest in a milder form. Persistent hyperglycemia might impair the body's immunological response. Some infections become tougher for your body to fight against as a result, increasing in frequency, duration, or severity. Those with diabetes who have vaginal cavities likely to experience yeast infections more frequently, according to Dr. Hatipoglu. According to the NIG, this is because extra sugar from a high blood sugar that leaks out through the urine feeds the bacteria that might cause severe illnesses. The CDC states that having diabetes may increase your risk of developing UTIs. 8. Slowly healing wounds. Dr. Hatipoglu claims that high blood sugar levels can also have an impact on your body's circulatory system, affecting blood flow and the body's capacity to recover. According to the Mayo Clinic, slow healing sores are a common indication of this poor circulation. 9. Dental problems. Both your saliva and your blood contain glucose. According to the NIG, when there is too much of it, it promotes the growth of dangerous bacteria in your mouth, which then combines with food debris to form plaque. Problems including dental decay, cavities, gingivitis, gum disease, and poor breath result from this. One of the first things to watch out for is swollen, painful, or bleeding gums. 10. Ringing in the feet and hands. According to Dr. Hatipoglu, over time, hyperglycemia can start to affect nerve function and finally result in neuropathy, or damage to the nerves. According to the NIG, peripheral neuropathy, which affects the extremities, is the most typical type. According to the Mayo Clinic, you may begin to experience tingling, numbness, or burning in your hands, feet, arms, and legs.